Assalamualaikum warahmatullahi wabarakatuh. Let me introduce my group. We are from group 2. The members are Kinanti, Resti, Fany as a nurse, Laila Ramadhani as a patient, Masita, Aqla, Dzakia as patient's mother, and Melda Lestari as patient's aunt. Scenario: in Melati's room of our bros, there is a child patient. Her name is Lala. She is 6 years old. She is diagnosed with leukemia. In hospital, she accompanied by her mother and her aunt, Mrs. Masita and Mrs. Melda. Lala's mother doesn't know which treatment is good for her child. Doctors recommend chemotherapy for Lala as soon as possible, but her mother and aunt don't know what is chemotherapy. So the nurse will assess the families to understand of chemotherapy and provide information about chemotherapy procedures, and also the nurse will provide information about Lala's condition to her mother and aunt.
Good morning, Lala, Mrs.
Good morning to nurse.
Morning to nurse.
I am Nurse Kinanti that will take care of you today. Start from 1 p.m. until 6 p.m. later. You can call me Nurse Auntie. How are you feeling today, Lala?
I feel I'm a little bit tired, nurse.
I see. I'm sorry. Are you Lala's mother?
Yes, I'm Lala's mother. My name is Masita, nurse.
Okay, Mrs. Masita. May I sit here?
Sure.
Okay, thank you. How do you feel today?
We are fine, but I still think about Lala conditions often.
I see. I understand how you feel. I hope you are always strong and be patient regarding Salah's condition. So I come here to talk with both of you about the treatment that will be given to Lala, because the doctor said Lala will get a chemotherapy in the next few months. So today we will talk about it. Maybe for the next 15 minutes. Is that okay?
Yes, I want to know more about chemotherapy.
Okay, so let's talk about it. Are you comfortable if we talk here?
No problem, nurse.
Okay, thank you. Before that, I want to ask you something. Do you know what chemotherapy is?
I only know that chemotherapy makes people weak and their hair falls out.
Yes, you're right about the side effect of chemotherapy. But each person has different side effects of chemotherapy.
So what is chemotherapy, nurse?
Okay, Mrs. I will answer that. Chemotherapy is a cancer treatment where medicine is used to kill cancer cells. There are many different types of chemotherapy medicines, but they all work in a similar way. They stop cancer cells reproducing, which prevents them from growing and spreading in the body.
How long this chemotherapy to take, nurse?
In general, I think chemotherapy can take about 3 to 6 months to complete. It may take more or less time depending on the type of chemo and the stage of Lala's condition. It's also broken down into cycles which last, I think, 2 to 6 weeks each.
Oh, I'm afraid of the effect of chemotherapy on my child, nurse. Please help me.
I can understand your concerns. As well as killing cancer cells, chemotherapy can damage some healthy cells in your body, such as blood cells, skin cells, and cells in the stomach. This can cause a range of unpleasant side effects, such as feeling tired most of the time, feeling and being sick, hair loss, an increased risk of getting infections, a sore mouth, dry, sore or itchy skin, and diarrhea or constipation. But don't worry, many of these side effects can be treated or prevented, and most, if not all, will pass after treatment starts.
Oh God, why all of this happened to my child?
Mom, what happened with me?
Nothing, dear. Everything will be okay.
No, Mom, don't cry. How about my condition? I'm going to die.
No, Lala, you are not going to die, but you will visit the hospital frequently and occasionally for treatment. Your disease is not contagious and we don't know yet what causes it, but we will do our best to take care of you.
Is that mean that I cannot meet and play with my friends, nurse?
No, you can still meet your friends and play with them. But I think you have to meet your friends in the hospital, and I think it's a little bit hard for you to meet them frequently because you must take care of yourself first, okay?
Okay, nurse, I will get better soon.
Hi, Tata. Who is he?
Hi, Melda. This is Nurse Auntie.
Oh, okay. Hi, nurse. I'm Melda, Lala's aunt. Are you checking my nice condition?
Yes, you're right, Mrs. Melda. How is your day?
I'm fine, but I'm a little bit concerned about my nice condition and my sister feelings because Tata looks so sad and tired.
I see. I can understand that. But still, we will do our best to take care of your niece.
Yes, I can see that. But I think Lala is a little bit lonely in here. What do you think I can do for her?
If that's so, may I ask you a few questions, Mrs. Melda?
Sure, nurse.
I'm sorry, but are you married?
Yes, I am. Why is it?
Do you have children?
Yes, I do.
I see. Then I think you can bring your children here to accompany Lala so she won't feel lonely.
Is that okay?
Yes, of course. Lala will be very happy because she has some people to play with her.
Okay, then I will do that. Thank you, nurse auntie.
It is my pleasure, Mrs. I think it's time to wrap our conversations. What do you feel after I give some information about the chemotherapy treatment?
Mm, I'm I am a little relieved now. Thank you for your information, nurse.
You are welcome, Mrs. Masita. Do you have any question?
I think that's enough for now.
All right then. I think the time is up, so I'll come again later at 5 p.m. to check Lala's condition. Please call me with pressing the bell behind Lala's bed. Excuse me then, and goodbye, Lala.
Goodbye, nurse. Thank you so much, nurse.
Okay, once again, thank you so much, nurse.
Okay, once again, thank you so much, nurse.
You are welcome. I'll see you guys later.
Okay, thank you.